Using Research Findings for Advocacy, a presentation by Amanda Riekert, Ph.D., and Audrey Schremmer-Philip. This video is part of a presentation that was first given at the annual conference of the National Council on Independent Living, NCIL, in July 2011. Audrey Schremmer-Philip, Executive Director of Three Rivers Center for Independent Living in Wamego, Kansas, discusses her center's use of research for advocacy and their collaboration with Amanda Riekert, Research Director at the University of Kansas Research and Training Center on Independent Living.
I'm Audrey Schremmer-Philip, the Executive Director at Three Rivers Center for Independent Living, and we serve what we refer to as Central Northeast Kansas. It's a 10-county area that has some metro, mostly rural, and we also have a unique project. We have a Native American independent living project on the Prairie Band Potawatomi Reservation. We serve on general, we have about 800 consumers ongoing, and we also provide the home and community-based services and fiscal management services for personal attendants. I think that it's extremely important for the IL community to have evidence-based research for actually several different reasons. First of all, I want us to have access to reliable, meaningful research because that helps us be more effective in our service provision. We all know Centers for Independent Living, we're unique. The independent living philosophy is totally based on the individual needs, and rightly so. But I think that we get so caught up in the individual needs that we don't have time or forget to look at the bigger picture. I like to use the example of the trees in the forest. We spend all of our time managing the trees, and I think that evidence-based research helps us take a step back and look at the forest. So we know that as CILs, we're passionate about doing things better. We have peer-to-peer mentoring projects. We're always looking at best practices, sharing information, and evidence-based research is an easy way to get to that. So I'm glad that Amanda and others are working on these areas. It's great information from us and for us, from us, and that's what makes it the most powerful too. It's not somebody doing research off somewhere that isn't meaningful. We like the way that it's handled, and it will really benefit us. And I think that also in today's economy, meaningful outcomes are what matter. Particularly here in Kansas, the focus is on outcomes, outcomes, outcomes. And we're not talking about individual outcomes. When it comes to the legislation looking at funding, to say, oh yes, all of our people are meeting their goals and they're doing better, it doesn't matter to them. They want to see how does that impact the community, what's the best way for dollars to be spent. And if we can look at evidence-based research to help us guide our services and improve our services, and hopefully look at what are meaningful outcomes to legislators, that's going to help us in the long run. And I know nobody likes to hear that. That's the thing that we fight, because we're all about the independent living philosophy. But I see us, at least for the next 5 to 7 years, having really powerful influence from funding cutbacks. That we are going to have to learn to be the best that we can be for the least amount of dollars, and going to have to find a way to say, here's what we do it the best, and here's why it's the best impact for the community. And our evidence-based research can really help push us to that point and make us better in the long run. So another way that we've used evidence-based research and helped participate in research projects was done through KU, where our targeted case managers for people with physical disabilities were able to see Medicaid usage and able to access through the individual's health information screenings and tools that might be helpful for them based upon their conditions, their age, and other factors. And initially staff were skeptical about that. They were concerned it was just extra information, didn't really see how it was going to be useful. But towards the tail end of the project, we really began to see the value in it. That we understood that getting screenings in advance can help prevent conditions. We can educate people, which we know that education is so powerful. And people with disabilities just don't access the medical services that they need. They may be focused on their primary disability, and not on the other secondary conditions that can impact them. And Amanda's current research on secondary conditions has been very powerful for me, something that we've suspected for a long time, that it's these secondary conditions that cause even more physical harm to individuals. So we were really excited to participate in the project. We were hopeful that there might be some funding to continue this ongoing. And I think that this could be good information for the future, that hopefully we can get the right people to fund these projects and help us focus on health, because we know that's a major concern. I think the most effective use for evidence-based research outside of how it impacts what our services are working with legislators. And I mentioned that earlier, that they want to know that there's responsible spending for the tax dollars. So I think it's important for CILs to look at the research and maybe even talk with individuals like Dr. Riekert and others who are doing the research, so that you gain a good understanding, because most of us weren't trained in this field. But it's easy to understand once you start talking about it. Then you can have intelligent conversations with your legislators and be able to talk with them about how this research might impact their districts, because that's what matters. The people you serve are the people they serve, and you can work together to improve their health, their well-being, their ability to live independently in their communities. So I think that's a very powerful use for the evidence-based research, something that they can understand and grasp. I also find that the evidence-based research helps us gain buy-in on projects when we're looking at other community service providers. Another example that we used was particularly with the medical field. We received a grant on working with families with children with special health care needs. And we talked about how's the best way to do outreach to these families, and particularly to reach families that have children, newborns or newly diagnosed special health care needs, and determined that the medical field was the way to approach them. Without having some evidence-based research on the need to gain early support systems and how that impacts children and family lives, we wouldn't have been able to get buy-in with our physicians. They just see us as somebody wanting to gain a referral, and they're not sure why you want that referral. So we were able to share the research with them, and we held a big disability caucus for our region, and we're able to get referrals and get new families in and help them develop support systems, which was really beneficial for these families. And at the caucus, they also shared with us that lack of information, lack of knowing where to go, is the biggest barrier that families face. So that was a very powerful message to get that and bring people together. I also find that evidence-based research is best when you're trying to get grassroots actions happening. That it's very good to be able to share the research with the community people, with interested parties, and it gets buy-in, and it also gets a focus and something to refer back to if you're comparing numbers and looking at how your community measures up with some of the research that's out there. It's a real powerful tool for that. When it comes to using evidence-based research with consumers, I really find that varies. We'll have some consumers who it's very meaningful to, and other consumers who are like, yeah, I'm just me, that's all I want to talk about. I don't care what happened in this study, I'm unique and it probably doesn't impact me. But I feel it's important to share information, like when we do our projects, the Living Well with Disability project, or it's talking about the secondary health condition research that Dr. Riekert has done. It's important to get them the information. How they choose to use it is totally up to them, and that's the independent living philosophy. Make sure they've got the knowledge, they've got the tools, it's there if they want it. So we definitely need to share information with the consumers when we have it available. And another thing that I think is something that we're very interested in is not just learning about the evidence-based research, but starting to have conversations with the individuals like at KU and other places and talk about what we feel our needs are as Centers for Independent Living, as the disability community. I would love to see us have regular conversations, at least annually, and talk about where we think needs are in terms of research to allow the staff to be able to forward plan, see if it can meet their needs. And I think that would be really beneficial to us in the future as well. Like I've said, we need to develop these meaningful outcomes. We need to address health concerns, and in my opinion, the independent living community is like is a frontier. Not enough research has been done that's meaningful to us, And there's a lot out there that I know can benefit us, and a lot more research can be done to help guide us in whatever it takes for us to be the best we can be.
This video is a project of the Research and Training Center on Measurement and Interdependence in Community Living, MICL, which is funded by the National Institute on Disability and Rehabilitation Research, NIDR. To see the PowerPoint that accompanies this video, visit www.rtcil.org/MICL, then click on Projects/R2, or contact Amanda Riekert, PhD, Research Director, Research and Training Center on Independent Living, email reichard@ku.edu, phone 785-864-4095, touchtone phone 785-864-0706, mailing address the University of Kansas, 4089 Dole Center, 1000 Sunnyside Avenue, Lawrence, Kansas 66045.